everybody, it's Dr. Tracy Papa. Today we're going to talk about one of the most common problems that women have in pregnancy, and that's gestational diabetes. About 8 to 10% of you are going to get this diagnosis at some point during the pregnancy, and it takes you by surprise. You're cruising along, enjoying your pregnancy, picking out strollers, living your life, when suddenly you get this diagnosis and you're like, wait, what? What we're going to do is talk about the 10 most common lies that people will tell you about diabetes in pregnancy, and we're going to counter this with the truth, because if you know more about this condition, you're going to be able to manage it successfully. So here we go. Lie number 1, this is all my fault. It's not your fault. It's nobody's fault. Sure, some people have a genetic predisposition to diabetes, or you may have risk factors like being overweight or having excessive weight gain in pregnancy. That doesn't make this your fault. Diabetes is no one's fault, and the sooner you accept this, then the easier it is to move forward and manage this. Lie number 2, I have no control over this. That's simply not true. In fact, the opposite is true. When you have diabetes in pregnancy or otherwise, you have almost all the control. So the decisions that you make right now, what you decide to eat, how you decide to move your body, are going to give you control over this disease and make you feel more powerful than you have ever felt in your life. Lie number 3, my pregnancy is destined to end badly. Nonsense. Most people who have diabetes in pregnancy have successful outcomes and beautiful, healthy babies. You will appreciate yours even more because you've worked harder to get there. Babies of diabetic mothers are more likely to be big. There can be a higher risk of birth injuries, but that's okay because you're going to work hard to make sure that this doesn't happen. And if it does, we're just better prepared for it. We watch diabetic women more closely in pregnancy. So take a deep breath and relax. Lie number 4. Am I going to have to take shots or take medicine that could be dangerous to the baby? Well, the truth is that you might be placed on medication, and that's okay. Most pregnant women are able to manage their diabetes by modifying their diet and their activities, but sometimes we need to use medication to help keep your blood sugars under good control. And if we do, most of the time you can stop these medications as soon as the baby is born, and these medications are safe in pregnancy. And most of all, we talk about this with you before we make a decision like that, and you get a vote, so we can talk about pros and cons of different medications and make a decision that's going to be right for you. Lie number 5, I'm going to have this forever. Well, not necessarily. Many women who have gestational diabetes do go on to develop diabetes later in life, and about 30% of gestational diabetics will stay diabetic after the pregnancy. So that amounts to about a 60 to 70% chance that diabetes is somewhere in your future. But that's not necessarily a bad thing, because this is a heads up that you're getting in pregnancy that this is something that you're going to have to deal with long term. So the changes that you're making right now are just going to reduce your risk of developing diabetes or staying diabetic after the pregnancy. Lie number 6, I have to give up all my favorite foods. That's not necessarily true. A diabetic diet is not a diet in the conventional sense. You don't have to deprive yourself. This is not necessarily a calorie-restricted diet. You're not going to be hungry all the time. In fact, eating like a diabetic is going to help give you more energy, help keep you from having the munchies all the time, and set you up for better health long term. Lie number 7, there's no time to make a difference. Well, there is. There's always time to make a difference. Even if you're diagnosed with diabetes late in pregnancy, 7 months along, 8 months along, it's never too late to make some positive steps to make a difference for you and your baby. Lie number 8, I'm all alone. You may feel alone, but trust me on this, you are not alone. So many women are struggling with this condition right now, and they feel like they're all alone because before it happens to you, it's not personal. Now it's very personal. But we have all kinds of amazing tools, resources, recipes, diet advice, exercise tips, things that are going to help you crush this. Lie number 9, I can't eat out at restaurants. Well, if this were true, I wouldn't eat at all. take it from me, as a diabetic and as a busy working person, I eat out all the time. At almost any restaurant, you're going to be able to find things that you can eat very safely, and you don't feel like you're the one at the table watching everybody eat the good stuff while you munch on your carrot stick. You can find things that are healthy and delicious that are going to make you feel like you're part of your group and not being punished. Lie number 10. This is too complicated. I have to start checking my glucoses, going to the doctor more frequently, eating differently. Something bad could happen to my baby. This is big stuff. I get it. This is not a diagnosis that you were expecting or that you signed up for, but here you are. What I want to tell you is that maybe this is not a complete lie. Sure, it's complicated, but it's not too complicated. I believe you've got this. We've got some very good tools and resources that we'll be sharing, and together, you and I have this. And there you have it, the 10 most common misperceptions about gestational diabetes. Just remember, it's different for everybody. One treatment definitely does not fit all. You're going to learn to listen to your body, talk to your doctor about what plan is going to work the best for you, and then take steps to take control. Thanks so much for watching. We've got a lot of interesting content coming up, including common problems in pregnancy, birth defects, interviews with patients and with other doctors. You can always find me on social media. You can connect with me on my website, drtracypapa.com, and feel free to like this video and subscribe to the channel. See you soon.